discussion of clinical reconciliation and the encounter and category view filter enhancements. These enhancements and features are certainly something to be excited about because it means less clicks for all end users. I also encourage everyone to go into the test environment, create visits, and practice all UD2 enhancements and updates. So some of the clinical reconciliation enhancements are the medications. If duplicate items were included, it will be set to ignore all but one of them. Previously, everything that was pulled in, the system wanted you to add them. SureScript's history would show every time the med was refilled, creating duplicates and causing a lot of work for our end users. Grouping logic that looks for the same med ID, GCN or NDC. So it's just going to look for those numbers to try to match up the duplicates. And the most recent prescription will show at the top and be set to add. Default sort options to return through the original sort setting. So if your sorting changes, it breaks three groups. It breaks the grouping for duplicate items. So if you use the default sort, it'll revert back. Status columns move next to the medication name. Improvements to status data have been updated. SureScript's med history does not display a status, and the CCD and the CCDA can display an appropriate status. Unfortunately, because this is a test system, I'm going to have to show you this through slides versus going in the test system and showing it to you live. So here you see that there's duplicate medications, and they've only set it to add for one of them. And the rest are set to ignore, so that's going to take a lot of work from you guys. Here's your default sort, so if you sort it by date, original start date, directions, stop date, you can hit the default sort and it'll go back and revert back to your original sorting. Here's your status where they move this over next to the medication, pending, inactive. And next I want to go over the encounter category view filters. This I'll be able to show you in the test system, but here you'll see on the patient history bar that there's a filter, and this has been also added to the category view. So you'll be able to look at the 90 days worth of encounters, first year worth of encounters, so on and so forth. All right, so let me demonstrate this encounter category view filter. So here you see it over here on the patient history bar. If I go to category view, you'll see that you have the filter as well. You can look at the last 30 days. You can look at the last 90 days. You can look at the last 1 year. You can look at all visits since the last visit with the current provider. So if you sent them to you referred them to a specialist, you'll be able to view that encounter. And since the last visit to the current location. So if they've seen somebody else in your office other than you, you'll be able to see those visits as well. And then to go back to the previously, before you apply the filter, you want to make sure it's filtered. The same thing for category view, you have all the same filters. And again, I just want to point out, in order to go back and clear your filter, you must drop down the arrow and click clear filter. So if you have any questions, please email help@tpmgpc.com. And again, I want to encourage everyone to go into the test environment, create visits, and practice all of the UD2 enhancements and updates. Thank you and have a great day.